Welcome to the Greenbridge Minute, brought to you by Greenbridge Health and Greenbridge Society. I'm Dr. Gerald Knapp. According to the American Sleep Association, 50 to 70 million adults in the United States suffer from a sleep disorder. Insomnia is the most common sleep disorder. 10% of adults report having chronic insomnia, and approximately 30% report having short-term issues. Cannabis has been used to aid with sleep for thousands of years. In ancient India, cannabis was used to treat insomnia, and in ancient China, as early as 200 CE, a mixture of wine and cannabis was used as an anesthetic before surgery. Early on, the effects of cannabis on sleep were reported in Western medical literature. In the 1860s, the German physician Bernhard von Muller tested the effects of Indian hemp in 1,000 patients with sleep disturbance. 53% of the patients reported a curative effect, and over 21% experienced a partial cure. Much more recently, in 2019, a study was published in the Journal of Psychoactive Drugs, where researchers surveyed 1,000 dispensary customers in Colorado. 74% of those surveyed reported using cannabis to improve sleep. Of those using cannabis for sleep, 84% found it very or extremely helpful, and many of those patients reported stopping the use of prescription and over-the-counter sleep medications. We see similar trends in the medical cannabis states. Although sleep disorders are not approved conditions for many medical cannabis programs, many patients report using cannabis to help improve sleep. Many of our patients suffering from anxiety, PTSD, chronic pain, and cancer also have trouble falling and staying asleep. Let's look at some of the literature surrounding cannabis and sleep. The endocannabinoid system, which is composed of endogenous cannabinoids and receptors, regulates dozens of processes within the human body. So it is no surprise that it impacts sleep too. The endocannabinoid system is involved in the regulation of the circadian sleep-wake cycle, including the promotion of sleep. Phytocannabinoids are cannabinoids that are found in the cannabis plant. THC and CBD are the most prominent phytocannabinoids found in cannabis. THC, or tetrahydrocannabinol, may help patients fall asleep faster. A small trial compared different doses of THC in insomnia patients. The 20 milligram dose produced the best results in reducing the time needed to fall asleep. The average improvement was 62 minutes faster than placebo. THC seems to help with obstructive sleep apnea as well. Dronabinol is a synthetic version of THC, and it was used in a sleep apnea study reported in 2016. The study compared a placebo, a 2.5 milligram dose, and a 10 milligram dose. These were taken 1 hour before bedtime for 6 weeks. The 10 milligram dose reduced the apnea-hypopnea index by approximately 50% and produced the highest ratings of treatment satisfaction. In my experience, cannabis seems to be the most effective in treating sleep disturbances in patients with comorbidities known to be helped by cannabis, such as chronic pain, anxiety, and restless leg syndrome. And the scientific literature supports this too. Nabilone, another synthetic form of THC, was shown to improve sleep in patients with chronic pain, including patients with diabetic neuropathic pain and chronic non-cancer pain. We see quite a few larger studies looking at synthetic THC drugs like Nabilone and Dronabinol, since they are funded by the pharmaceutical companies. Another example is a trial published in 2009, where Nabilone was studied in 47 patients with PTSD-related treatment-resistant nightmares. 60% of these patients experienced complete resolution of nightmares, and an additional 13% had a satisfactory reduction in symptoms. CBD, or cannabidiol, is considered the second major cannabinoid, and like THC, it also seems to have an impact on sleep. Lower doses of CBD can have a stimulating effect, while higher doses are typically sedating. A study from 1982 compared 5 milligrams of a benzodiazepine with different doses of CBD. While the benzodiazepine had no effect, the 160 milligram dose of CBD 30 minutes before bed significantly increased the number of hours slept. There are other components in cannabis that may affect sleep as well. The minor cannabinoid CBN may add to the sedating effect of THC. Some of the terpenes, such as linalool and myrcene, which are naturally found in cannabis, seem to play a role too. Not all the research surrounding cannabis and sleep is positive. There is some evidence suggesting that THC may reduce the quality of sleep, and that sleep disturbance is linked to cannabis withdrawal. Overall, more research is needed in studying the use of cannabis in sleep disorders. At Greenbridge Health, we work with patients to find the best cannabis regimen for them. We also help patients evaluate the products available to them at their local dispensaries. Although every patient is unique, we do see some general trends surrounding sleep. Fast-acting products, such as inhaled forms of cannabis, seem to work best for helping patients fall asleep. In most dispensaries, cannabis strains are generally separated into 3 categories: sativa, hybrid, and indica. Typically, the indica strains are going to be more sedating than strains in the other categories. In general, patients inhaling an indica strain of cannabis higher in THC 15 to 20 minutes before bed have experienced the best results in falling asleep. Many patients struggling with staying asleep find relief by adding a longer-acting dosage form before bed. As you can see in the graph, the inhaled form of cannabis has a quick onset, but it only lasts 1.5 to 2 hours. A longer-acting product, such as a capsule or tincture, can help carry the patient throughout the night. With the proper cannabis regimen, we have seen many patients discontinue their OTC and prescription sleep medications. At Greenbridge Health, we help each patient find their best cannabis regimen. If you would like to schedule a medical cannabis consultation, please go to our website, greenbridgehealth.com, and make an appointment to meet with one of our experienced medical professionals. We look forward to helping guide you on your cannabis journey back to health.